Reminder, the training that we have been doing with PacMOSSI is actually got four separate arms to it. We have the online course that provides training. A lot of it's theoretical training, but we try to make the sessions as engaging as possible. We then have the practical workshops where we bring people in, do regional trainings. We will have one of those later this year. And we have the mentoring program that's recently been established. And then the fourth arm of our training is the in-country technical support or assistance that we use as follow-up. We've had Rodney Bellwood doing that. We will also be bringing Rama Vineshwar on board as well to assist with some of that in-country training later on this year, as well as some of our other representatives from other partner organisations. So I think without further ado, we'll talk about the online course and some new modules that will be developed. For this, I will throw to Tim Freeman and Melanie Koinari. Tim is from Naraya Consultancies and Melanie works for JCU and also for PNG Institute of Medical Research. So over to you two. Thanks.
Thank you. I think I will start the presentation and Tim will come after me. So we are developing 2 new modules to support the VBD control. One is on the program management, VBD program management, and another is on implementing dengue vector control. So for this presentation, we'll be talking about the challenges and the possibilities that, such challenges and opportunities or possibilities that we see in the Pacific. Next slide, please. So PacMOSSI has a number of online courses or modules. I think modules is the right word, which cover vector-borne diseases, particularly malaria, dengue, chikungunya, and Zika. And these courses cover all aspects of WHO guidance, mosquito vector surveillance and control, insecticide resistance, data management, behavioral change, communication, and operational research. And PNG Institute of Medical Research and Naraya Consultancies, we are tasked to write 2 more PacMOSSI modules, which will look at the practical side of VBD control. And the manuals, so these online courses, they also come with the manuals, and the manuals are a guide to program managers, which looks at all aspects of managing or coordinating a nationwide VBD program, and a practical guide to vector control, and a detailed look at all the different types of vector control methods presently available. Next slide. So just again, a bit of background, mosquitoes transmit a number of diseases in the Pacific region. And the viral one, we have dengue, chikungunya, Zika, Ross River virus, Japanese encephalitis, and West Nile fever. And we have lymphatic filariasis and heartworm, which are caused by roundworms, which are also normally found throughout the Pacific. Lymphatic filariasis has now been eliminated from Cook Islands, Marshall Islands, Kiribati, Niue, Palau, Tonga, Vanuatu, Wallis, and Futuna by mass drug administrations. And malaria is limited to PNG, Solomon Islands, and Vanuatu. So the 2 new modules will focus on dengue, chikungunya, and Zika. It is estimated that there are up to 500 million cases of dengue worldwide, and it's very prevalent in the Pacific. Chikungunya and Zika are also very common in the Pacific region, with over 100 outbreaks being reported in the last 25 years. This figure here shows some data from for the last 25 years. And you can see dengue has been there all the time. And then we have cases of chikungunya and Zika. So dengue is kind of really common, followed by Zika, the outbreaks, and then chikungunya. Next, please. So some of the challenges that we face that have already been mentioned in the slides earlier today. So here we have Aedes-borne diseases. They require additional attention, but their control is challenging in the Pacific Island countries for the following reasons. Difficulty to definitively diagnose, and also RDT availability is limited in some Pacific Island. You'll see no cases until then there'll be an outbreak, a large outbreak with fatalities. And vaccines for some of these diseases are very expensive. And then we have these diseases that are transmitted by different mosquitoes with different habitats and behaviors. They require tailored approaches in different settings due to mosquitoes and human specificities. And they're difficult and expensive to control with conventional methods, example, IRS and ORS, and of course, limited financial and human resources in most of the Pacific Island countries. And next slide, please. Continue with the challenges. So generally in the Pacific Island countries, when there's when there is an outbreak of Aedes-borne disease, then the vector control, comes in, like we have said, like with Elias mentioned, like about the spraying and all that comes in after an outbreak is experienced. Then as a control is difficult and expensive, practical, innovative, and low-cost interventions are required. WHO guidance on dengue, chikungunya, and Zika proposes that Pacific Island countries move from reactive responses to outbreaks to prevention of outbreaks, which involves having very clear national strategic plans for actions. And Pacific Island countries should form strong partnerships with other government departments, donors, NGOs, CBOs, and private sectors. And there should be an emphasis on community engagement. And WHO advocates for a reduction in VBDs by 75% in terms of mortality and 60% in terms of incidence by 2020. That's relative to 2016. Next. Tim,
Sorry,
you are
Tim.
on mute.
We're going to unmute you now.
Okay, good morning, everybody. I hope you can all hear me. My name is Tim Freeman. I've been working more in the malaria field in Papua New Guinea since 2010, and been very much part of the malaria control program there. And been very fortunate and thankful to PacMOSSI for bringing me in here, because this has a lot of parallels with what we've been doing in malaria. So the first thing is, one of the things I'm seeing as an outsider here is that, and particularly here in PNG, that these viral diseases are not very well prioritized. In fact, in PNG, we just get to hear rumors that there is an outbreak going on, but nothing else is ever recorded. So really what we need to do to make sure that we have these things put as a priority is having a detailed situation analysis in each of the PICs on the actual disease burden, vector densities, insecticide resistance, climate predictors, and any other factor that might increase or decrease vector-borne diseases in the PICs, such as mentioned previously about travellers bringing into VBDs into the country. Once you have situation analysis, then you should start working with partners. This is part of the cell program, aspect, getting partners involved and interested, and getting them to help you to put together a national strategic plan, which outlines the findings and the possible solutions to the problem. We also should make it a costed national strategic plan, because it's possible to advocate for vector viral-borne diseases to be a priority with each PIC and appeal to funding not only from your own governments and donors, but also agencies like the UN and also local charitable organisations like I've been associated with Rotary Club PacMOSSI to fund parts of the MSP. So you don't necessarily have to find big lots of money, but you need to have lots of people coming in to help you. And then basically you will need to create a functional vector control unit in the Ministry of Health if you don't already have one, which has funds and the operational capacity to work. Next slide. Hello? Okay. So there needs to be an effect. So the major thing was, and I asked a question, how do you detect things? Certainly in PNG, that we have no system to actually detect these diseases. And normally it's when a huge number of diseases come through, people start taking notice and they start responding to it. So really, to achieve this, we need to start ensuring that our health staff are able to recognise the signs and symptoms of vector-borne diseases, ensure that the reporting system allows these increases to be recorded easily and passed on to national level. I see that as the case in some countries, such as reporting through the National Health Information System, which, as I said, has no provision in our National Health Information System to report these diseases. To help you, and especially since many of the countries in the PICs are reasonably small, could consider putting into a community reporting, not only for the mosquitoes, but also for the presence of disease by asking people simple questions, are certain signs and symptoms appearing in the community? And then consider all of the possible reporting routes. Somebody already mentioned about points of entry, people coming in from outside, and this is also important about follow-ups. But often, from my experiences in other parts of the world, often control programs only discover problems through the newspapers or through what I might call a bush telegraph or other sources. Next slide. So one of the things that's really clearly coming up is about improving diagnostic facilities. And I think program managers should actually know what facilities they have. And if you can't have these within country, to make sure you have very good liaison with surrounding countries to make sure where those laboratories exist, so you can get very fast responses when you need to know what you've got. Another thing is that vaccines for VVDs, which certainly exist for dengue and for chikungunya, they're very expensive, but you might consider procuring them to be sold to citizens who might wish to pay for the protection. As the control of diseases through vaccines is extremely expensive, vector control, therefore, is really the preferred option for, in any circumstances, to control the disease. So really, with your national strategic plans, you need to define the malaria control priorities during outbreaks. So in particular in outbreaks, whether you should be using IRS or outdoor residual spraying, depending on which species of Aedes is transmitting. You should be having a very clear messaging system through behaviour change communication materials to mobilise the whole population. And then also community mobilisation to eliminate or modify all larval habitats. And I say community here rather than individual, because what I've noticed is a lot of the materials out is encouraging householders to do things, but really, if you can get communities to mobilise together, it makes the response much stronger. Next slide. By define urban control properties, yes, there are different areas which, first of all, urban areas. There are legislation in many countries which allow you to fine householders, allow mosquitoes to breed in their habitats. If you're clever, you can get those funds to actually finance your own urban malaria control programs. Personal protection obviously is a very strong one, which people can buy in for themselves and protect themselves as individuals and communities. Private sector, there's no point in promoting things if you cannot buy the things in the shops, so you really need to find systems to get the private sector to stock the items that you think will be useful, not only during outbreaks for normal protection. Communities, these are a system that we tend to forget, but they are often the most powerful people to promote change. So together with community surveillance, also activate health village programs or healthy village programs to collectively modify or eliminate all potential breeding sites. Habitats for mosquitoes, larvals should be targeted as community support will be enhanced. If what we're saying is here, don't just target Aedes, target everything, because communities won't necessarily support your activities if you're just taking out one type of mosquito and there's lots of other ones biting you. And then you've got program implementation. Due to expense, IRS and ORS would normally be used only for outbreaks, unless there are special circumstances, such as mass gatherings where you might need more control. Next slide. Next slide. Okay, so here are the programs. So basically, my side is doing the program management side. We're looking at not only health surveillance, looking at also control. It's beginning to start there, using emphasis on getting collaboration from partners, getting as many people into the mix as possible. We need to have a strong monitoring and evaluation component, and making sure that the program is prioritized in terms of coordination and planning. This manual is also to have little practical things like how do you calculate how much insecticide you need, which insecticides you should do, some guides on how to write national strategic plans, community surveillance, funding proposals, jobs, all the little things that will help you get your program moving. And then on the side of IMR and Melanie, it's about looking at more practical ways of vector control. What are the do's and don'ts, making sure that when you're trying to implement a program. Next one. So the design of both manuals is supposed to be very pragmatic and produce a low-cost approach to surveillance and vector control. The manuals also cover the management and implementation of all activities and suggest practical ways to accomplish each aspect of the program. Where certain activities might not be feasible within the context of certain PACs, putting systems into place where you can get information from other people and work together with in a collaborative way. The overall message of both of these things is, if you have vision and you have people with initiative and a practical approach, in fact, anything is possible. Even when resources are not fully available through the MOH or traditional development partners, a lot can be achieved by simply working closely with those who are most affected by the vector-borne diseases, particularly communities who have all the local resources to deal with vector-borne diseases at their level, really at very little cost to the program. Next slide. Thank you very much. Tankatru and Tanakua Adaheria is Motuin, which is our third official language in PNG. Thank you very much.